Hello, I am Dr. Harish Kumar. I am the Professor and Head of Department of Endocrinology and Diabetes at Amrita Hospitals, Kochi. I would like to share with you some interesting and somewhat alarming data that we have noticed in our hospital data. We have patients who come to us from all over Kerala, and we have noticed that there is a decreasing age that is seen in patients who are undergoing major amputations for diabetic foot complications. In 2012, we had only about 7% of patients who were below 50 who required major amputations due to diabetic foot complications. But by 2016, this percentage had gone up to more than double, and in 2019, it had almost trebled. So what is the implication of having an amputation at an earlier age? It obviously has a huge impact both on the individual, his family, and society at large. Because if you have an amputation at the age of 50, the impact is totally different from having an amputation at the age of 70 or 80. This somewhat alarming decrease in the age that we have been seeing over a period of 10 years is probably because of the fact that the age of onset of diabetes itself in India has been decreasing, and people are getting diabetes at much younger age, as a result of which complications are also occurring much earlier, and this leads to diabetic foot problems, and sometimes in order to save life we are forced to do an amputation, a major amputation. Diabetic foot complications like neuropathy, which results in insensate feet, and peripheral vascular disease, which affects the blood supply to the foot, are what actually set the scene for diabetic foot complications. So individuals who have neuropathy and peripheral vascular disease are at high risk of diabetic foot complications. But the good news is that diabetic foot complications can actually be prevented even if you have a high risk foot. For that, you have to take some simple precautions. All diabetic patients must keep their feet very clean. You should in fact examine your feet on a daily basis and make sure there are no small injuries or bruises or corns or anything that are developing. And also, as soon as you develop any kind of infection or injury, you should seek attention early. Other simple precautions which all diabetic foot patients with high risk are advised is to take care of their feet and prevent injuries, for example, by wearing footwear even indoors. In India, generally, we have a tendency to take off our footwear at the doorstep and then walk without bare feet inside the house. But we advise our patients with high-risk foot to use a separate footwear indoors, because injuries can happen even inside the house. There may be a pin lying around or some sharp object, and if you don't have sensation in the foot, then you're not going to feel pain, and this object might be the beginning, a sharp prick might be the beginning of a major diabetic foot problem. So by taking some simple precautions, even those who have high-risk feet can avoid problems. And this message about patient awareness and education about caring for the diabetic foot has to be spread across to all diabetic patients in order to reduce this alarming trend of increasing amputations at an earlier age. Thank you.